Hello guys. This is Dr. Rizwan Mirza. Welcome to my channel at Gerdologist.
Let's discuss two very important topics related to hypertension during pregnancy, that are preeclampsia and eclampsia. Preeclampsia is a serious medical condition that can occur during pregnancy or soon after childbirth. It is characterized by high blood pressure of more than 140 by 90, two readings at least 4 hours apart, and damage to organs, most commonly the liver and kidneys. Preeclampsia usually develops after the 20th week of pregnancy, although it can occur earlier. Organ damage in preeclampsia include kidney damage with proteinuria of +1 or more or raised creatinine greater than 1. Liver damage with raised SGPT greater than 50. Pulmonary edema. In blood tests low platelet counts are observed. Neurological involvement with headache and seizures might be seen, and visual disturbances can be observed during preeclampsia. If it is left untreated, it can lead to severe complications for both the mother and the baby. Preeclampsia is a leading cause of death worldwide for women, fetuses, and newborns. So, regular prenatal care and monitoring are essential to detect preeclampsia early, to avoid the unwanted complications to the mother and the fetus during and after pregnancy. It can develop without you realizing it, so it's important to learn the symptoms. Let's discuss the symptoms of preeclampsia. 1. High blood pressure. This is a key feature of preeclampsia. Blood pressure readings consistently above 140/90ths of a millimeter Hg are considered elevated in a 20-week pregnant lady. 2. Proteinuria. This refers to the presence of excess protein in the urine. It's often a sign that the kidneys are not functioning properly. 3. Swelling. Edema, or swelling, can occur in the hands, feet, and face due to fluid retention. 4. Headaches. Persistent and severe headaches, often accompanied by visual disturbances, can be indicative of preeclampsia. 5. Abdominal pain. Pain in the upper right side of the abdomen can be a sign of liver involvement. 6. Changes in vision. Blurred vision, light sensitivity, and other vision disturbances can occur. 7. Nausea or vomiting. Sometimes, preeclampsia can cause nausea and vomiting, which can be mistaken for normal pregnancy symptoms. So what causes preeclampsia? The exact cause of preeclampsia is not fully understood, but it's believed to be related to problems with the placenta, blood vessels, and the immune system. Let's discuss the risk factors. The risk factors for developing preeclampsia include 1. Being a first-time mother. 2. Having a history of high blood pressure. 3. Obesity. 4. Certain medical conditions like diabetes or kidney disease can cause preeclampsia, and 5. Having a family history of preeclampsia. How do we treat preeclampsia? Treatment of preeclampsia include 1. Managing blood pressure. 2. Bed rest. 3. In severe cases, delivery of the baby is the best option in treating preeclampsia, even if it's preterm. The antihypertensive medications considered safe during pregnancy include methyldopa, labetalol, nifedipine, hydralazine. The antihypertensive medications contraindicated during pregnancy include angiotensin-converting enzyme inhibitors or ACE inhibitors, angiotensin receptor blockers or ARBs, direct renin inhibitors, thiazide diuretics, spironolactone. Let's discuss the complications that a mother or the fetus might face in cases of preeclampsia. Preeclampsia can progress rapidly and can lead to more severe complications to the mother, including eclampsia, stroke, organ failure, and even death. To fetus, it can negatively impact the fetal growth and development, potentially leading to preterm birth and low birth weight. Should patients with preeclampsia be followed after delivery? Yes. Preeclampsia may continue after childbirth, or it may develop for the first time after postpartum. Thus it is important to continue to check blood pressure after delivery and at follow-ups, for up to 6 weeks postpartum. Let's discuss what is preeclampsia superimposed on chronic HTN. So, if a lady already had hypertension before she was pregnant, but it was well controlled on her prescribed medications. Now she observes new readings of raised blood pressures with increase of 30 in her systolic and 15 in her diastolic pressures. After her 20 weeks of gestation along with other organ damage is discussed in preeclampsia. It is called preeclampsia superimposed on chronic hypertension. So coming to eclampsia. Eclampsia is a serious and life-threatening complication of pregnancy that typically occurs in the 3rd trimester. It is characterized by the development of seizures or convulsions in a pregnant woman who previously has been diagnosed with a preeclampsia. Eclampsia can be very dangerous for both the mother and the unborn baby and can lead to complications such as oxygen deprivation for the baby and injuries to the mother due to the loss of control during the seizures. Let's discuss the treatment options of eclampsia. 1. Immediate hospitalization. 2. Medications for seizure control, such as magnesium sulfate. 3. Medications to control blood pressure like labetalol, hydralazine, or nifedipine. 4. Continuous monitoring of the mother. 5. Continuous fetal monitoring. 6. Delivery of the baby is the best option, in severe cases. 7. Close monitoring postpartum, for at least 6 weeks must be done as it is observed that eclampsia just like preeclampsia can occur even after delivering the baby. 8. Supportive care including providing oxygen, maintaining fluid and electrolyte balance, and addressing any other medical issues that may arise during the course of treatment. If you have any query or a question, do leave us a comment.
Subscribe to my channel at YouTube at Gerdologist and press the bell icon for updated video. You can also follow my page at Facebook and follow me on Instagram. And if you like the video, don't forget to like and share the video.